My name is Jasjot and I'm a final year student in Faculty of Nursing. I'm part of a study called Firefighters' Mental Health and Their Psychological Wellbeing at Work. Our work addresses the critical issue of how to better support firefighters in Calgary as they increasingly respond to mental health and addiction-related emergencies. We collaborated with the Calgary Fire Department and the City of Calgary to explore what structural and organizational changes can be made to strengthen firefighters' mental health. Study has two main aims. First, to understand firefighters' experience when responding to mental health and addiction related calls. Second, to assess opportunities to enhance mental health supports within the Calgary Fire Department. Most existing research on firefighters focuses on physical health risks such as smoke inhalation, cancers, and fitness. However, mental injuries like PTSD, burnout, anxiety, and depression are becoming increasingly prevalent, especially as firefighters taking on new roles responding to overdose and mental health crises. In prior studies, over 97% of firefighters have experienced potentially traumatic events during overdose responses. Previous interventions have often emphasized individual coping strategies rather than tackling the organizational and systemic cause of stress. We used a mixed methods approach for this study that combined surveys and qualitative interviews. First, I distributed a survey that asked firefighters about their experiences. I went to fire stations across the city to talk about the survey and encourage people to participate. Following the survey, I interviewed firefighters to learn more about their experiences and what could be done to support their mental health. During the interviews, firefighters shared their reflections on the meaningful nature of their work. Many expressed a deep sense of pride and fulfillment in serving their community, emphasizing how rewarding it feels to make a positive difference in people's lives. They described a strong sense of responsibility and commitment to public safety, which gives them a profound sense of purpose. However, several participants also acknowledged the challenges that come with the role, particularly when interacting with public people when tensions are high or emotionally charged situations. These moments, while difficult, are part of a complex reality of their profession. We tracked several themes when we conducted thematic analysis with these interviews. One of the most prominent themes was compassion fatigue due to answering many overdose calls during their shifts. Firefighters described it as carrying a backpack full of same feelings and frustrations. Many expressed a sense of generalized frustration and loss of joy in their work as they repeatedly respond to similar overdose situations. Recurring theme was perceived lack of fit between the fire department and their calls. For example, deploying fire trucks for calls that primarily involve administering naloxone. Firefighters also told us they didn't feel they are always equipped to respond because of their different skill set and focus of their work. During the interviews, firefighters emphasized that engaging in debriefing sessions after difficult calls and having open conversation with colleagues played a significant role in maintaining their mental health. The strong sense of teamwork and mutual support among firefighters allowed them to rely on one another during challenging calls. Firefighters highlighted the need for additional organizational supports, such as enhanced access to psychological counseling, more frequent mental health check-ins, and structured peer support programs. Our next stage will involve collaborating closely with the Calgary Fire Department to design and implement interventions that strengthen mental health supports and reduce occupational stress. Overall, firefighter mental health is a vital component of our emergency response system. Supporting the psychological health of firefighters not only benefits the individual themselves, but also enhances the overall resilience, safety, and effectiveness of our public safety network. In the end, I would also like to acknowledge Calgary Fire Department and the City of Calgary for funding this project. A big thank you to Dr. Jennifer Jackson from Faculty of Nursing for all of her guidance and support throughout this project. Thank you.